Coming to the other division of coagulant drugs, thrombolytics, also called fibrinolytics. Now these are used to lyse the clot or thrombi by natural fibrinolytic system. Now, what's the natural fibrinolytic system? Plasminogen will be activating into plasmin in the presence of tissue plasminogen activator and then degrade the fibrin which dissolves the clot. Now, we have the divisions of the classification of thrombolytics, which are streptokinase, anisterplase, urokinase, and tissue plasminogen activator. So now, streptokinase, which is obtained from beta hemolytic streptococci, actually these have a very severe side effects, which are allergies and hypotension. And the anisterplase, which is a form of streptokinase, it has an advantages over the streptokinase, which it is long acting and also it is given in IV, so that it is easy to handle than the streptokinases. Now urokinase is actually cultured from the human kidney and activate the plasminogen. It has the normal fibrinolytic action. While coming to the tissue plasminogen activator, these ELT-plase, DUTE-plase and RATE-plase. ELT-plase and DUTE-plase, which is recombinant DNA technology products, which are processed tissue plasminogen activator, whereas RATE-plase is a product of genetic engineering, which is a modified human tissue plasminogen. So these three are produced by humans by recombinant DNA technology and genetic engineering. So now the adverse effects of fibrinolytics is bleeding. This is a major side effect, and hypotension, fever, and allergies is mostly caused by streptokinase. So the major adverse effect is bleeding. Now the uses of fibrinolytics is acute myocardial infarction, where while the person is suffering with myocardial infarction, these thrombolytics will be given in intravenously, where it decreases the acute myocardial infarction. See, these thrombolytics should be given within 12 hours or immediately can be given, which results in decrease in mortality rate. Deep vein thrombosis, which leads to large pulmonary embolism. This deep vein thrombosis mostly formed on legs. If it's not treated, it could lead into lungs, which leads to large pulmonary emboli. So now thrombolytics can also be used in curing deep vein thrombosis along with the large pulmonary emboli. So now this is about thrombolytics or fibrinolytic drugs. So what are the drugs of thrombolytic and fibrinolytic drugs? Streptokinase, anisterplase, urokinase, and tissue plasminogen activator, which is ELT-plase, DUTE-plase, and RATE-plase. Contraindications to thrombolytics are if the patient undergo recent surgery. If the patient undergo recent surgery, if any injury is present on the patient, or GIT bleeding, gastrointestinal bleeding, or any stroke occurs, if any heart stroke or any heart problems, the thrombolytics would be contraindicated, and hypertension, also bleeding disorders, would be contraindicated for the patient if these are present. Now, the other division, which is antifibrinolytic, inhibit the activation of plasminogen. Examples of antifibrinolytics are EACA, which is epsilon aminocarboic acid, and eprotenin. Now these bind to plasmin or plasminogen, which prevents the binding of fibrin to the proteins. So now what does this EACA do? They bind to plasmin or plasminogen, which prevents fibrin from binding to the proteins and dissolving the clot. So now plasmin and plasminogen prevents the binding of fibrin to the proteins. Now, the rest is the bleeding and a condition called hyperplasminemic state. Hyperplasminemic state, a condition in which the tissue is rich in plasminogen activator, where these certain conditions are where the conditions which results in increased plasminogen activator are overdose of fibrinolytics, bleeding peptic ulcers, when the hemophilic patients use mouthwash for bleeding gums in dental procedures. And then epistaxis and nose bleeding, hereditary angioedema, which is rare. So what happens in hereditary angioedema is plasmin induced uncontrolled activation of complementary system is activated. The plasmin induces the complementary system which is uncontrolled by the patient or the body of the patient. Then the complementary system is activated. So now antifibrinolytics are used for these purposes where the overdose of fibrinolysis occur, peptic bleeding of the peptic ulcers occur, the hemophilia patients when there is without any knowledge they use the mouthwash for gum bleeding and lead to hyperplasmic state, then the fibrinolytics are assisted, epistaxis, hereditary angioedema. Now coming to antiplatelet drugs, which is an other group of drugs used for disorders of coagulation. And antiplatelet drugs are again subdivided into 4 types, which are PGs like prostaglandin synthesis inhibitors, which is aspirin, phosphodiesterase inhibitors, dipyridamole, ADP antagonists, which is ticlopidine, glycoprotein 2A 3A antagonist, which is abcizimab. So now these are the 4 categories of antiplatelet drugs, which is prostaglandin synthesis inhibitors, phosphodiesterase inhibitors, ADP antagonist, and glycoprotein 2A 3A antagonist, which is aspirin, dipyridamole, ticlopidine, and abcizimab respectively. Now the uses of antiplatelet drugs are mostly related to heart, and these are other than heart, which is hemodialysis related to kidney, cerebral thrombosis related to brain, and transient ischemia can occur anywhere including brain, and peripheral vascular diseases and vascular graft when any part is transplanted. Vascular graft can also, if any changes in vascular graft occur, antiplatelet drugs can be given. So, related to heart, we have myocardial infarction. If any myocardial MI occurs, aspirin is given immediately to relieve the myocardial infarction. And for unstable and stable angina pectoris, aspirin is given. The patients who have prosthetic heart valves, who undergo bypass surgery, low dose of aspirin is recommended. And also cardiac procedures, the patient who undergo cardiac procedures, and atrial fibrillation. So for atrial fibrillation, when oral anticoagulants like warfarin is not given, if it's not suitable for the patient, then aspirin is recommended. If for atrial fibrillation the warfarin, oral anticoagulants are not recommended, aspirin is given for the patient. So now these are the uses. Uses include the uses regarded to the heart, which are myocardial infarction, stable and unstable angina, prosthetic heart valves, and the patient who undergo bypass surgery are recommended to use low dose aspirin, cardiac procedures, atrial fibrillation. While coming to the non-heart diseases, we have hemodialysis, cerebral thrombosis, transient ischemic attack, and also the peripheral vascular diseases and vascular graft. So now these are the uses of antiplatelet drugs, and that's the classification of antiplatelet drugs. And now let's discuss about the coagulants, which is another division of drugs used in disorders of coagulation, also called as procoagulants, as discussed earlier in the starting of the classification. Now coagulants are divided into local, tropical or stepsis, and systemic coagulants. Tropical includes adrenaline, thrombin, fibrin, gelatin foam, thromboplastin powder, and astringents. And systemic include vitamin K, fresh plasma, fibrinogen, anti-hemolytic factor, desmopressin, and ethamsalate. And then in tropical or local coagulants, we have adrenaline, which is used in bleeding in tooth sockets and epistasis, which is nose bleeding, and thrombin, which is dusted over the bleeding surfaces to arrest the bleeding, and fibrin, which is used to pack the bleeding surfaces, like in a outline form. The fibrin is used to pack the bleeding surfaces, and gelatin foam, if any cut occurs, gelatin foam along with the thrombin is placed over there, and the gelatin foam is absorbed after 4 to 6 weeks. And then fibrinoplastin powder is used in surgeries, and astringents is used in bleeding gums in dental practices. Now in vitamin K, fresh plasma, fibrinogen, anti-hemolytic factor, desmopressin, and ethamylate is used orally, inhibits synthesis of prostaglandins. Actually, this mechanism is not known clearly, but it is believed that it inhibits the synthesis of prostaglandins and is used in dental extractions in patients with the coagulation disorders. The patient who come for dental extraction, ethamylate is used in the patient who have clotting disorders and postpartum hemorrhages. Now coming to vitamin K. Vitamin K is a fat soluble vitamin, and there are 3 types of vitamin K: vitamin K1, vitamin K2, vitamin K3, in which vitamin K1 is available in plants. Vitamin K2 is present in the gut bacteria of us humans, and it is also synthesized by the gut bacteria. And also vitamin K3 is synthetic, which is man-made. Now the actions of vitamin K are: it synthesizes the clotting factors 7, 9, 10, and also prothrombin. Also requirement 50 to 70 mg per day. It is not clearly known, but it is indicated that 50 to 70 mg per day is it is a requirement of vitamin K for an individual. Deficiency of vitamin K leads to liver diseases, malabsorption, and obviously bleeding disorders. And adverse effects include: the side effects of vitamin K would be jaundice. This would be routine administration of vitamin K 1 mg intramuscularly in the infants could prevent the hemorrhagic diseases. Why only infant means? In infants, they will not have gut bacteria to synthesize vitamin K, so would lead to hemorrhagic diseases. So to prevent this, we have to administrate vitamin K of 1 mg every day or intramuscularly to prevent the hemorrhagic diseases in the infants, and also to prevent the oral anticoagulation toxicity, vitamin K is used. So now this is a description of coagulants.